Hi, Dr. Muscolino again, and what we want to do now in this portion is to highlight some of the things we found on examination. The steps with a new patient are consultation, examination, a report of findings to the patient, and then, of course, treatment. One of the famous diagnosticians from Mayo Clinic said that 90% of what he finds is found in the initial consultation, and I believe that to be so. That's why we don't rush the consultation. We let the patient speak. We ask leading questions to find out what's going on, and then we follow it up with a thorough examination, including orthopedic, neurological examination, kinesiological examination, and in some cases blood tests, hair analysis, and sputum analysis. I'd like to just highlight some of the testing that we did with the kinesiological on this patient to show you some of the reasons why we do what we do. So, if the patient can appear, and I'm going to turn her so that we get a view of her spine. And without going any further than just a quick analysis of her condition, I note that the right shoulder is a little bit higher. It was much higher before she started treatment, but it's still a little bit higher, which means when I go through all the muscle testing, that the muscle test on her right lat, latissimus dorsi, for those people who work out, is what they're trying to get a better figure, a better V shape by helping their lat. And when we test this particular patient, hold your arm here, resist again, hold it. This is very strong. But when we test this side, this particular muscle, hold it, is quite weak. Now we know that the lat is associated with the pancreas. They both get the same nerve supply, blood supply, acupuncture energy, lymphatic drainage, and so forth. So by recognizing that this is weak, the leading question to this patient is, how do you do with energy? Do you feel more tired in the afternoon between 1 and 4 o'clock? How do you feel? You know, when you first came in, you said you were very fatigued. Is that still true to some degree between 1 and 4? Mm-hmm. And if you have too much sugar, what happens? Do you feel more worn out or energized? Energy is low and so forth?
Energy is a little better.
It's getting better, but it was very low. We're seeing a patient who we previously examined, and what we found at the beginning was that she had a hypoglycemic tendency. Her blood sugar dropped, and therefore, when we see that this weakness exists, we suspect that there's a metabolic fault, and one of the things we want to do is help the nerve supply to the pancreas and adrenal, as well as put her on the proper diet so that she has more energy. The fact that this was weak showed that the lat was weak. If you turn this way, now there are certain test points that Dr. Goodhart in the 60s recognized. He's the founder of applied kinesiology, and I've studied under Dr. Goodhart and with Dr. Goodhart for many, many, many years. And what we find is that the adrenal gland is often weak. The test point for the adrenal gland, adrenal means it's located above the kidney, but the test point is right here. Could you put your hand here? And when she does this and we test, try to hold this as strong as you can. This goes weak. Touch anywhere else on the body, and this is very strong. I learned to grunt from my TV show. So with that, we now recognize that there's a biochemical imbalance. So if I were to introduce her to sugar, you would see that she can go weak. So with my trusty sugar, I want you to, I'm going to put this on her tongue, and before I do so, I'm going to test another muscle. Hold this as strong as you could. Resist. And this is very strong. And if we test here, hold it, and this is very strong. Let me just put a little bit sugar. Open your mouth wide. I always feel like a priest when I do this. Okay, now if we test you, resist, hold it, this is what happens. And I'm not pushing hard, but she's much weaker. And the reason is that she has this tendency of hypoglycemia, so one of the diets we will put her on is naturally a low sugar, low carb type of diet, more high protein, and so forth. Now, using that, we would go ahead and treat the areas that affect that particular area. So I'm going to demonstrate that by just using a very gentle method of opening up this articulation. Could you put your hands behind your head? So if we very gently just drop your head and just fall backward, there it goes. I don't know if you could hear it on the video and the camera, but there was an audible release, no pain, right? You didn't feel any discomfort. And the fact is that adjusting that area not only helped the nerve supply to the lat, latissimus dorsi, but also to the adrenal. Let's test. Hold your arm against your body, resist, and you can see now, hold it, that this is strong, and I'm pushing hard. Now, if we test the adrenal, hold your arm up and go underneath, resist. What does that feel like? A lot stronger. Okay, so what we were able to show you there is that we were able to help the adrenal, help the lat by a simple, and this is only part of what we do. So if we resist here, if we do what's called therapy localization and have the patient touch, could you touch right here? And when we do that, what happens typically is the patient goes weak. If we go up higher, somewhere where there isn't much irritation because the spine's in a better position, and we test, it's strong. But again, down here, it's weak. If I push up under that fifth lumbar, which is nerve supply to low back and legs, and if I push up there, she goes weak. Sometimes nerve irritation in this area can cause problems in the lower intestinal tract. It could cause problems with men, prostate area. It could cause problems with periods in women. So by adjusting this area, we're often able to help that particular area. Just for demonstration, I want to show that if I use a simple adjusting technique where we help lift that, and this is only part of the treatment. Naturally, we would do a lot more. We would balance some muscles in the low back just like we're balancing in this area as well. But when I push up now, you can see it's already getting stronger. So what I hope to accomplish is to show you the relationship between the spinal column, nerve root irritation, and how it affects different organs and different areas of the body, and the integration between the biochemistry by her using something to irritate the hypoglycemic tendency, how she actually went weak. So by integrating the structure and the chemistry, we're helping that particular area. For further information, please call me at 914-725-4844 to find out more about the integrated approach using structural, biochemical, psychological integration. Or if you want to find out more about how the nervous system, using Oscar here, can affect your body through spinal nerves going to all parts of the body, again, please call me either for further information or to set up an appointment for consultation. Thank you for watching this video, and again, call 914-725-4844. I could be reached at that number for both my offices, either at 1024 Wilmot Road, Scarsdale, my main office, or 166 East 88th Street in the city.